I think first of all, the biggest approval that came over the past year is kind of the establishment of ibrutinib as a frontline treatment for CLL. So many physicians have been using ibrutinib informally or otherwise as the frontline treatment for CLL. There have been 2 randomized trials led by the Alliance and ECOG, which have now established ibrutinib as the first-line treatment for all patients with CLL. So I think that's sort of the starting point, and I think that that's the most important finding. I think, beside that, what's an important finding are first the efficacy of venetoclax alone and in combination for patients with relapsed refractory CLL, as well as the recent approval of duvelisib for relapsed refractory CLL. I think both are important because both after initial treatment provide decent response as well as a good progression-free survival. So I think that what I wanted to focus on in this talk is which drug I would prefer to use first upon patients that relapse. What I commented on was, at least in terms of trial design, the duvelisib trial did not include patients that failed BTK inhibitors, whereas there were a few patients with venetoclax. And there's actually a little bit more data outside of the Murano trial to suggest that there's efficacy for BCL2 inhibition after BTK failure. So, so in terms of one thing I wanted to focus on is, the richness of data for using venetoclax, after ibrutinib failure, if that is going to be the first-line treatment for your patients.